Hi guys, welcome to the clinical vignette number 6. So let us see the question. Here comes a 7-year boy who is coming with a diminution of vision, especially in the dim light. They have given you the fundus findings and one more thing, which of the following is most commonly associated with this patient. Now, though the question says only one line, but there is so many things which you can observe. There is diminution of vision in the dim light. So that means this patient is a case of the night blindness. We are having the night blindness in this patient. Now, whenever we see a young boy having the night blindness, yes, the first thing that comes to our mind is retinitis pigmentosa. Let us see if we can find her. So look at the fundus here. You can see, yes, we are having the pale yellow waxy optic disc. We are having the pigmentary spicules and you can see the arteriolar attenuation. So the typical triad of the retinitis pigmentosa is given here. We have the pale and waxy optic disc. Then we have the pigmentary spicules. The pigmentary spicules are also there. And then number 3 is the arteriolar. We have the arteriolar attenuation. That is also there. Okay. Now, there is something else also they have given which is very, very interesting. And I think you must be knowing this. What is this? These are actually called as the spur cells. Now, once you know that these are the spur cells, these are also called as the acanthocytes. These are also called as the acanthocytes. So if I am having the triad of retinitis pigmentosa along with the acanthocytes, along with the acanthocytosis, what is this actually? Now they have asked you a easy part. They have just asked you, okay, what is this? So basically, if I am having the retinitis pigmentosa along with the acanthocytosis, it is actually Basson-Konsvig syndrome. This is called as a Basson-Konsvig syndrome because here we get the A beta lipoproteinemia. A beta lipoproteinemia which will have the acanthocytosis. So similarly, other systemic associations of the retinitis pigmentosa are again very, very important. If you look at them, one is the Lawrence-Moon-Biddle syndrome. Then we have the Cook-Innes syndrome, the Refson syndrome, the Usher syndrome, and the Holmgren syndrome. So what are the different things? If you see in the Lawrence-Moon-Biddle syndrome, you will have obesity, we will have hypogonadism, we will have polydactyly. While, mainly we have mental retardation included in many of them, mental deficiency you are finding in many of them here also. In the Refson syndrome, you have cerebellar ataxia and peripheral neuropathies. In the Usher syndrome also, we have the labyrinthine deafness and then ataxia and the deafness are present in the Holmgren syndrome. So again, a very important topic of retinitis pigmentosa. Just remember the triad and see that extra thing that can be a common cause of that syndrome. Stay tuned. Happy ophthalmology.